Hi. Um, so to answer the first question that said, describe a case in which you observed non-adherence with the behavioral protocol. Um, I've experienced this quite a bit with my job that I currently do. I have a lot of parents that come in and say, we want help, but we want you to fix our child. So we have this program called Active Parenting Now, and so we always explain to the parents that it's not only the child, also the parents need some work too. And so basically, this program just kind of reviews over parenting strategies that's going to help them and their child succeed. We have 3 different programs. We have preschool, we have elementary students, and we also have preteens to teenagers. So, like I said, during this program, the parents have to work on skills, especially a couple of them are communication skills, and setting logical consequences and being consistent when it comes to consequences. And they continue to reinforce that if you're not consistent with consequences and you might lack for a minute, a child will learn that quickly and continue to try to test the parent in a certain way till they get what they want. So I've worked with several parents that, say nothing's working, and they continue to, and I continue to ask, have you been consistent? Well, and maybe I haven't been as consistent as I possibly could be, or I'm not doing this or that. So that's just something I have seen on a regular basis in my job that I work at. Usually whenever that does happen, I will go to my supervisor and we sit there, we try to come up with a plan, continue to kind of talk. If things don't change and parents feel like they don't see the changes, sometimes all of us will come together and we'll have another meeting and kind of express why the importance of consequences, being consistent, and etc. That's used in this video to explain and help the parents to be successful parents and to help their kids to be just as successful. So in the readings of Allen and Warzak, I thought it was a really good article. I felt like it addressed a lot of things that arise and come that we're going to encounter in our field. Just one thing, while just reading it and knowing that parents are not always consistent or not don't follow through, or they're busy people, everyone's busy, and we know obviously parents that have children with developmental disabilities and with ASD have a lot more stress. But I wasn't sure, maybe talk to the parents about the importance. I mean, I feel like that was addressed, but talk to them a little bit more about the importance. Also, while it was coming to while reading it, this question came to me is, how long do you work with a family that continues to not follow through with the treatment recommendations? The one that came to my mind was the week rules piece, and if parents can't follow the rules that they kind of talked about and be consistent with what we're asking, why and maybe how would that conversation look like? I mean, in the PowerPoint we kind of gave a couple examples as the doctor prescribing us antibiotics to help us with our illness or whatever's going on. But the main thing that came to my mind was, how do we continue to kind of help reinforce those parents? What could we say to the parents to kind of get them motivated a little bit more and encourage them, even though they have a whole bunch of other stressors going on, which I feel like we could also validate at that point, and just tell them that, we're trying our best to help and to make their environment a little bit better than what it is at this moment. So I feel like that's kind of an important thing to maybe add on to the something I would change with the article, and also just maybe what a discussion would look like if a parent just does not continue to follow through with recommendations, and what might we do. So just a couple things. Thanks.